My name is Nicole, and I'm a clinical pharmacist at the Miriam Hospital and an MTM or Medication Therapy Management pharmacist here at the Cardiopulmonary Rehab. Today we are going to discuss exacerbations or flare-ups of lung disease and how we treat it. For those of you with lung disease, you know your body's best, and it's very important to listen to your body when it's telling you something is wrong. If symptoms develop that are worse than ever before, they're new or alarming, you should definitely reach out to your doctor immediately or call 911 if it is an emergency. Even if something seems not right, but you kind of can't, something's wrong, something in the back of your head is telling you might have something going on, I definitely recommend not hesitating to reach out to a doctor because it's important to be proactive. At the very least, they'll give you peace of mind, or they'll guide you to whatever the next steps are to get you the proper care you need. So, exacerbations, signs and symptoms that you're having a flare-up. Usually we think about this with COPD or chronic obstructive progressive pulmonary disease. I added an extra P there for you. COPD, we all know. So symptoms of that would be increased shortness of breath, more than usual, increased chest tightness due to inflammation that's happening acutely, or increased mucus or sputum production. I know it's really gross, but it's actually so important for people with lung disease to all pay attention to what their mucus is looking like. A slight change in your mucus, whether it's how much or the consistency or the color, is important because it's actually your lungs telling you what's going on inside your lungs, right? So if you ever notice all of a sudden that you have more mucus than usual, or it's really thick and difficult to get out, it might mean that something's going on in your lungs. But especially if the color changes, we want to be mindful of what color it is, because the color of your mucus may tell you if you have a bacterial infection going on in your lungs. Our mucus is always changing, always looks different, always has different colors, but if it ever becomes bright green or neon yellow, that is a warning sign that there is bacteria in your lungs and you need antibiotics. So if you cough up mucus and it looks bright green, we want you to call the doctor immediately. We don't want to wait if you have an infection in your lung. Don't want to wait or waste any time to make sure you're getting that treated. So the treatment of flare-ups, kind of like I'm mentioning, is usually always steroids, by mouth steroids, antibiotics, and supportive care, including cough suppressants, expectorants, rescue inhalers, and oxygen if you need it. So we're going to start by kind of focusing on the oral medications that are used to treat the flare-ups. The first is the steroids, or prednisone most commonly. Prednisone has the most evidence to prove that it's going to help how you're feeling when you have a flare-up. It's considered a corticosteroid, but it's not the inhaled version that's in some of your maintenance inhalers. It's the by-mouth version. I'm sure many of you have been on prednisone before, or many times. So prednisone, or corticosteroids in general, they're very similar to the natural hormone in the body that is considered the stress hormone, or cortisol. Pretty much if you have increased cortisol, it's usually because you're stressed for different reasons, or there's inflammation going on that will cause stress, especially to your lungs. So prednisone is usually treated for many different things, like if you have some sort of autoimmune disease or skin disease going on, or a bug bite that's really bad, things like that. But when it comes to COPD, prednisone is a mainstay focus. It works by decreasing the airway inflammation in the lungs by suppressing your immune system to allow that to happen. So there's different things that can kind of cause the inflammation in your lungs. That can be damage from smoking. That can be if you worked someplace where you had to inhale chemicals for a long time. Or just different things that we can not control, like our genetics, can cause that inflammation to be chronic. If it ever gets worsened, it can cause you to have that obstruction of your lungs and cause the exacerbation. So we want to fix the inflammation, reduce it by having a steroid on board in your body, and it will allow you to breathe more effectively while you're trying to feel better. Now, steroids are tricky because they can have a lot of different side effects. There are side effects that we're concerned about when you're using a short course of therapy, and then different side effects when we're thinking about if we're using prednisone for a long period of time. There's actually more side effects that we're concerned about if you're using it for a long period of time. Prolonged steroid use, it affects your immune system. So that's why, we want to make sure that every time you need a steroid in your life, that it's an appropriate reason. Usually for a COPD exacerbation, it's a short course, maybe prednisone 40 milligrams for 5 days only. So with that, we are less concerned for those long-term effects of steroids. The most common side effects would be upset stomach. Sometimes, if you take the steroid too close to bedtime, it'll keep you up. It'll cause insomnia. And some other people might experience some, they might have some fluid retention. Their legs might get a little swollen if that's something you're prone to having. Or some people, especially if you already have diabetes, you might see that your sugars are higher, and that's caused by the steroid specifically. Now, when it comes to those most common side effects of prednisone, I usually tell everybody the most foolproof way, hopefully, to avoid the side effects is to take your steroid first thing in the morning with food or breakfast. If you take it with food, it may decrease that experience of having any GI, stomach upset. And if you take it early in the day, hopefully you won't have any issues sleeping at night. Everybody's body's different. Everybody experiences side effects differently. So you want to be mindful of what you're experiencing and be sure to let the pharmacist or doctor know if it's of concern. Another important point when it comes to taking your steroid is we never want to stop taking our steroids abruptly, especially if they're at higher doses. That 5-day course of 40 milligrams, not of concern, but you may have been put on a prednisone taper, which means that you took this many pills this day and then this many pills this day, and you decrease and decrease and decrease until you're done. And that's because we don't want to have your immune system pretty much rebound and cause different types of side effects. So we want to make sure that we take our steroids as prescribed. If it's a taper, want to be patient and take all the pills as directed to make sure we avoid any problems. Okay, so we talked about steroids. The next approach to treatment is antibiotics. And the reason why we need antibiotics is we want to cover any bacteria that may be causing infection in your lungs at that time. COPD exacerbations can be caused by many different things. It's not always due to bacteria. But in some cases, there may be an infection brewing, and we want to be ahead of the game. So usually doctors will also have you start a short course of antibiotics. Usually that's azithromycin, 500 milligrams for like 3 days, or a Z-Pak. I'm sure some of you are familiar with the Z-Pak. But there's many other antibiotics that the doctors consider, and it's based off of different things about your health and about what's the most appropriate in that moment. Antibiotics are usually only used when someone is having a moderate to severe exacerbation, and that usually means your symptoms are worse than your normal, and you're having significant shortness of breath doing your normal day-to-day activities. So you really can tell that something's wrong. So when it comes to antibiotics, I'm sure everybody has experienced, an antibiotic giving them some upset stomach here or there. That's one of the most common things that antibiotics do. They can cause nausea, vomiting, some people diarrhea. So it's important to kind of take it with food, and if need be, especially if you're someone who was really struggling with side effect of diarrhea or you have been on antibiotics very frequently, sometimes it's important to consider a probiotic as well. Some of the antibiotics that we use are kind of hardcore, kind of hard on the stomach, and we have good and bad bacteria in our stomach. If the antibiotic is hardcore, it's going to not only work on the bad bacteria in your body, but it's also going to start to get rid of and treat the good bacteria. And when that balance is off, you can start to have diarrhea and some of those more uncomfortable side effects when it comes to your stomach more frequently or persisting after you're done with your antibiotic. So over the counter, you can buy a probiotic, and what it will do while you're taking the antibiotic, it'll just help balance that and offset any of those issues in your stomach. So there's some things that the doctors are focusing on when they are choosing an antibiotic for you. One is your exacerbation or flare-up right now complicated versus uncomplicated? So pretty much that means, how severe is it? What is it? Is it worsening some other part of your body? How severe is your shortness of breath? Do you require oxygen? Things like that. Some people, like I said, have been on numerous antibiotic courses. We want to make sure that we're using one that's appropriate and it's not too close to the last time we used it. Other people have allergies to antibiotics, so we want to make sure it's appropriate. We're not at risk for that. If you're able to, some doctors actually will specifically take a swab of your mucus and they will look it under a microscope and culture the bacteria specifically so that they can determine what antibiotic is going to work best in that moment based off of what's in your mucus. Also, certain antibiotics are chosen if you're considered high risk. High risk people, high risk patients with lung disease are those who had a recent hospitalization. So usually that means you were in the hospital for 2 or more days and you were back in the hospital within 30 days after that. So a readmission in 30 days. Frequent antibiotic use is considered. For example, if you in the last year had 4+ courses of antibiotics for COPD or lung disease, that's high risk. Also frequent steroid use, same thing. With those, we're concerned about making sure that your steroid course and your antibiotic course in that moment is going to work for you, because our bodies are changing, our immune system is changing, and the bacteria is changing. So we need to think about all 3 things. The most important thing to think about when taking antibiotics is to be sure to finish the entire course. You need to take all the pills in your bottle, regardless of if you start to feel better. Usually people, after a day or 2 of their antibiotics, feel like a brand new human being, and they're like, wow, it's done, it's fixed, I feel better, I don't need to take those anymore. Especially if, they're causing you side effects. But we want to make sure, even if you're feeling better, that your infection is completely gone, cured in your body. And actually, finishing your antibiotic course affects the people around you in the community. Bacteria, just like viruses, are super smart and they can adapt. They pretty much exist to adapt and survive no matter what. So they can mutate and change and learn how to be resistant to the antibiotics. That happens when antibiotics are used inappropriately. So sometimes people will get prescribed an antibiotic, but they don't have an infection from a bacteria. Or when people don't finish their whole course of therapy of their antibiotic, that gives the bacteria an opportunity to, be tricky, be smart, and figure out a way to become resistant to it. And we don't want our antibiotics to be resistant to different bacteria that are causing these major infections. So it's super important to make sure that we finish the whole course of not only the steroids to keep inflammation at bay, but also to finish our full course of antibiotics for not only ourselves and our well-being, but for everyone around us. So, steroids and antibiotics are, the active treatment for what's going on in your lungs. We also have supportive care, which focuses on the symptom management while your prednisone and antibiotics are kicking in and working in your system. So things like that include expectorants, which is working on your mucus, cough suppressants, and then other things like if you need albuterol to open your airways, or if you need oxygen therapy to make sure that you're getting enough oxygen in your body. Those are all things that we're thinking about as well while you're being treated. So to think about expectorants, if you think about expectorants, you're thinking about Mucinex, right? So what they do is they change the mucus in your body to promote your lungs to cough it out. So mucus is a good thing. I know it's really annoying and I know it's really gross, but the mucus in our body changes because it's constantly trying to protect the lungs. So what it does is it actually increases mucus production, the medication, the Mucinex. It increases mucus production while decreasing the thickness of the mucus. I'm sure you have all felt when you feel really chesty, you have super thick, gross mucus stuck in your chest and your lungs and you feel like you can't get it out. We want to make sure that that bacteria that may be in that mucus comes out, right? So what the Mucinex does is it thins the mucus and it'll start making it move so you can cough it out. I want you to know though that sometimes the thinner mucus, not only can you cough it out, it can go the other way and go down into your stomach. So some people do, if they take a lot of Mucinex and they have a lot of movement going on with their mucus, tend to get some upset stomach. And that's not necessarily because of the medication, but it's because of the mucus that's causing that. So we want to kind of think about that, but Mucinex is, it's not the end-all be-all. It doesn't work the best for everybody, depending on your severity of what's going on. So what I tell everybody is water is the best expectorant. Water works to thin your mucus all day, every day. So if you feel like really that mucus is tough to get out, it's not moving anywhere, what I say is, increase your hydration. Make sure you're drinking enough water because it's going to break it all up and help keep all that moving. So we have Mucinex in our expectorants that works specifically on the mucus. Then we have cough suppressants. Similar to mucus, coughing is also a protective measure for your lungs, but it's activated by the brain. It's activated by an area called the cough center of your brain. What this does is it can tell that there's mucus in your lungs. Your lungs send signals, communicates with your brain saying, there's mucus here that I don't think should be here. So what your brain says is, oh, okay, we gotta get rid of that. And the brain tells your lungs and your body to cough it out. And what that does, just like with the expectorant, we want to pull that mucus away from the lungs. So that's why you cough. So when it comes to cough suppressants, there are a couple different things out there. Some of them are over the counter, some of them are not. Some of you may be familiar with dextromethorphan or codeine cough syrups, usually pretty nasty tasting, but those work essentially in the brain to decrease that cough center's response. We also have a different type of cough suppressant called benzonatate or the Tessalon pearls. Sometimes doctors will prescribe those as well. Some of you may have been on those before. When it comes to those medications, it's always in that little gel capsule. And with that medication, it's very important that you take it with a lot of water in order to allow it to dissolve appropriately. A lot of the other cough suppressants, like the dextromethorphan, that usually it can come in tablets, it can come in liquids, and usually if you want a medication to work faster, I recommend getting the liquid form. Even though it's really not ideal and tastes kind of gross, it's going to work and dissolve in your body and be absorbed faster. So when it comes to cough suppressants and expectorants, a lot of the supportive care options for these can be purchased over the counter at the pharmacy. And I'm sure you've been down the pharmacy aisles and see just a wall of all these different products of Mucinex. There's so many different types, and they can be a little tricky. I want you to know that many of the things that you see on the shelves are combination products. So, for example, there's regular Mucinex, but then there's Mucinex D, Mucinex DM, Mucinex PM, etc., different types of things. Now, these combination products are, tricky because we want to make sure that you're not taking something with ingredients you do not necessarily need or ingredients that aren't appropriate for you. Some may have extra Tylenol in them. Some have a cough suppressant and an expectorant together, or sometimes other ingredients like antihistamines that may or may not be appropriate. For example, certain cough suppressants may increase your blood pressure or worsen blood pressure if it's already high. So your doctor may tell you to avoid it, but you still want something for the mucus. You want to make sure that you're only getting just straight Mucinex, not Mucinex D, not Mucinex DM. And I tell everybody it's very important to, when you pick up the box or the product, you want to look on the back and kind of have the list of ingredients already there and, read and make sure it's what you need. If I think they're overwhelming, so don't be afraid as well to go to the pharmacist and ask them to clarify what product is best for me and what ingredients are in there. And they'll be able to best guide you to the best suited over-the-counter product to avoid extra medication that you don't need. So use your pharmacist, use your doctor. If you ever want to have a discussion with your doctor, just ahead of time, be like, Doc, I want to be proactive. I know that, cold and flu season's coming up. I want to have, something ready in my house. What do you recommend? For me specifically, and they can go through all of your medications and your conditions and make sure you're on a product that's going to be best for you. So when it comes to lung disease flare-ups or exacerbations, there's the most important things to think about are finishing your entire course of your antibiotic and your steroid as prescribed. You want to think about drinking more water when you feel that mucus is getting really thick, because it's the best way to break up the mucus, in addition to an expectorant over the counter. Also, do not hesitate. One of the most important things is to never hesitate to reach out to the doctor when your body is telling you something is wrong. We want to be proactive, especially when it comes to any infections going on. We don't want you to become too short of breath where it can be dangerous for you, and we want to be proactive because that discussion with your pharmacist, your doctor, whomever, may prevent you from having to come to the hospital. So just know, especially with all the different things that we talked about OTC products and what's best appropriate for me, know that myself, you can use me as a resource. I'm an MTM pharmacist, so that means that whatever you may need regarding, medicated related or not type of things, you have me as a resource now and an advocate if you need, some assistance guiding and navigating your disease states. So at any time, during your program or after, you can feel free to set up an appointment with me to chat about whatever you may need. If you're interested in that, I would reach out to your case manager and we can set up an appointment, usually a half hour, 45 minutes, whatever works best for you, and we can, chit chat about whatever you may need. So don't hesitate, and thank you so much for your time.